Good afternoon, everyone. Thank you for your time. We are HackEMR, a group of advanced degree nursing students fighting for interoperability amongst our healthcare facilities' electronic medical records, or EMRs. Interoperability is the ability of computer systems to exchange information in a useful way. For healthcare, this means seamless movement of data across multiple facilities and states. It is through this process that we have the ability to substantially improve our nation's healthcare. We humbly request your support in passing a mandate requiring all EMR systems in the state of New York to have interoperability capabilities within the next 10 years, as outlined by guidelines in the HITECH Act of 2009, which we will discuss shortly. But first, consider the story of a 28-year-old man named Solomon. Since the age of 10, he was diagnosed with a debilitating form of lupus. By his 28th birthday, he had 3 heart attacks, 1 stroke, and was in stage 4 kidney failure. Despite all these struggles, he was a charismatic young man, always putting his health first. Solomon presented to a New York ER after experiencing chest pain for more than 24 hours. When asked why he delayed seeking help, he explained that the chest pain started while driving back to New York from Texas. He was determined to make it to his home hospital due to a previous negative experience at an out-of-state hospital. He stated, "The thought of that experience of starting over and explaining my history to a new hospital, having them run unnecessary and expensive tests, made me sick to my stomach." Shortly after his arrival, Solomon began experiencing severe shortness of breath and became unresponsive. Resuscitation efforts lasted 40 minutes but were unsuccessful. This is an unfortunate story, but one that is not uncommon in our country. Now, we invite you to imagine the alternative. EMR interoperability allows providers and healthcare facilities to access medical records without delay, allowing responsible and informed care. But this affects everyone because we all have one thing in common. Despite our background or socioeconomic status, we are all consumers of healthcare. We are all patients. Interoperability means patient empowerment. The U.S. has already taken notice of the importance of interoperability. The Health Information Technology Act for Economic and Clinical Health, or HITECH Act of 2009, was created to stimulate the adoption of EMRs in the U.S., outlining certain common capabilities required of EMRs through the Meaningful Use program. Meaningful use of EMR technology meets certain requirements that enhance the quality, safety, and efficiency of healthcare with the ultimate goal of improving patient outcomes. Health information exchange is specified as one of these requirements, yet was never properly enforced and deferred to the second stage of this program, resulting in the creation of EMRs without this capability. It is our wish to remedy this problem. We have discussed the benefits to quality of healthcare, but there is another vital asset. As healthcare costs consume an increasing proportion of U.S. spending, we are left with a dire need for change. Health costs are now up to 18% of gross domestic product, yet recent estimates show that more than $700 billion of the $2.4 trillion in expenditures could be avoided through improvements to the healthcare system. The West Health Institute, a medical research organization focused on lowering healthcare costs, testified before U.S. Congress based on their 2013 study, estimating that widespread EMR interoperability can eliminate $36 billion of healthcare spending. In 2014, RAND Corporation, a nonprofit global policy think tank, released a report stating that if interoperable and interconnected EMRs are widely adopted and used effectively, the U.S. could save more than $81 billion annually. Waste takes many forms, including inefficiency, unnecessary services, and missed prevention opportunities. Interoperability is a vital step to diminishing this waste. We are here for support to mandate the requirement of interoperability of EMRs in the state of New York. Meaningful use guidelines from the HITECH Act, specifically health information exchange, must be the standard within the next 10 years. Patients like Solomon should not be afraid to go to another hospital based on fear of the providers being uninformed. This is devastating and unacceptable, and in this case, it likely cost him his life. Our message is clear and simple. The people of the state of New York want and need interoperability, and we are prepared to ask for it, nay, demand it. Thank you.